I'm Grace. I'm your lymphedema therapist today. Can you tell me why you're here today?
Yeah, I'm having some difficulty with my left arm. I think it's maybe swelling a bit more than my right arm, and it's causing me to have some difficulty in reaching, and it just feels really tight and kind of stuck a little bit.
So what we're going to do, I'm going to measure the circumference of your arm so that we can compare that to the right side to see how much of a difference there is.
Okay.
I'm going to measure the circumference at your ulnar styloid.
Okay.
And I'm going to go about every 4 centimeters from that.
Okay.
And then we take the measurement. Have you noticed anything else that it's been affecting your ability to do?
Well, sometimes it's a little bit difficult for me to wash my hair in the shower because I have to reach up, and I just feel like this is all pulling here. Sometimes it's really hard for me to lift things that are like any heavier than, I don't know, like a gallon of milk.
Mm-hmm.
Like when I go grocery shopping, when I'm carrying my groceries in, sometimes that gets difficult, or when I'm like doing cooking a meal for my husband and I. Sometimes, like, you know, when you have to, like, you have a pan full of water or something, that's really difficult for me to lift up just because everything just feels so tight and constricted all the time. I don't feel any pain though, it's just kind of an achiness,
I'm glad to hear that.
tightness. Sometimes it's itchy a little bit.
Now I'm going to go ahead and do your other side. Your right side was within normal limits, but it looks like your left side is a little bit more swollen than your right side because of that lymphedema.
Yeah, that makes sense. I mean, I think they took like 12 lymph nodes out the first time.
And that extra swelling explains why you would have some discomfort with reaching over your head backwards and lifting heavy things and those things that you mentioned earlier.
That makes sense.
And have you been wearing anything like compression garments to help manage that?
I have one. I'm really bad at remembering to wear it. So I was even like on an airplane the other day and I forgot to put it on, and that aggravated things a lot. So I have it. I'm really bad at wearing it. Sometimes I tear it off in my sleep without even knowing it because I think it just gets to me. I don't know.
Well, part of what I can do to help you is we can help find a schedule for you to wear that compressing garment so that it's easier for you to remember to use it and just that you can use it more consistently.
Yeah, that would probably be helpful.
And I'm also going to go ahead and look at your touch sensation on that left side just to see if that lymphedema has been affecting your ability to feel light touch.
Okay.
How many points do you feel?
1.
How about here?
1. 1. I think I feel 2 there. 2.
So since this is what we use, it's a 2-point discrimination test. So if you're able to feel the 2 points, it means you have an intact light touch sensation. But around in the shoulder area, you only felt about 1. So I think because of the associated with the lymphedema, we might have some impaired light touch here as well.
Do you think it could be from my surgery?
I think that could be left over from your surgery from when they took out those lymph nodes.
Okay. Yeah.
And because of the scarring too, that occurred from your surgery, that's another reason why your sensation might not be as strong.
Okay, so now that we've determined that we do have some increased volume on that left upper extremity, we're just going to do a little bit more assessment here. And what we have here is the shoulder pain and disability index. We call it the SPADI. I'm going to ask you these questions here. This first one is associated with pain, and I know we talked about how you're not experiencing a lot of pain, so you can rate those as a 0, or if you do feel like maybe some of these are accurate, rate that as you feel fit. And then the second one is our disability scale. So if you're having disability with any of these tasks, you can rate that from 0 to 10 for me. I'll give you some time to do that. You can let me know if you have any questions, okay?
Thank you. I don't think I'm having any pain, so that would be a 0.
Okay.
Even when I'm lying on my side, when I'm reaching, touching the back of my neck, pushing with the involved arm, I'm not feeling any pain with that.
That's great to hear.
It is sometimes difficult for me to wash my hair and my back just because of the discomfort with my lymphedema. And I think I would rate that as a 3.
Okay.
For both of those. I can put on a short just fine. Buttons are fine, so those will both be 0. Pants are fine. So I think I do have some difficulty putting some objects on a high shelf. Like if I'm putting my dishes away, or just putting like cleaning products up. So I think that would be a 2. It's some difficulty, but it's not too bad.
Okay.
I do have a good amount of discomfort when I'm carrying something like my groceries, a heavy pot. So I think I would have be about a 5 for something weighing over 10 pounds.
Okay.
And I don't have any problems taking anything from my back pocket, so that would be a 0.
Okay. Sounds good. I will score that here. So what I'm going to do is I'm going to add up the pain scale and the disability subscale. So for pain, she's at 0. And for the disability scale, we have a 13. So we're going to basically do a short formula, which is going to give us a 16.25% total disability scale, which comes out as some mild disability due to that lymphedema. Okay, so now that we have done this assessment here, I'm just going to ask you a few more questions. I am curious to know, I'm just going to write some of this down here. Are you experiencing any more fatigue after that second cancer diagnosis?
I have been. I notice it's hard for me just to do anything that requires a lot of time, like washing like a full load of dishes. I don't have a dishwasher, so it's really have to hand wash everything all at once, and that can be fatiguing sometimes.
Sure.
When I'm doing laundry, it's hard for me to fold a full basket of laundry. I have to I just have a lot of just more discomfort with my arm, like with folding everything, and it just takes me more time than I think it should normally take.
Yeah, so some of those household activities, you're feeling some discomfort, some frustration with some of those tasks. Okay, that makes perfect sense. Okay. So another question I wanted to ask you is, are you having any difficulty with any aspect of dressing? So putting any items of clothing on or taking them off your body?
Yeah, I noticed it wasn't in the SPADI, but I do have some discomfort, like reaching back. So like if I'm pulling a zipper or fastening my bra, it is a bit hard to do that just because of the discomfort.
Yeah. And I just wanted to ask you too, have you noticed any feelings of depression or anxiety since this second cancer diagnosis, or are you feeling like you're well supported?
I'm feeling well supported. I have my husband, he's always there for me, and he's been able to help me through this.
That makes me happy.
My grandchildren too, I just love seeing them, and they've also just being able to see them just help helps me get through the diagnosis.
Okay, perfect. I love to hear that. I'm glad that you're doing well in that respect. So we will work on some of these things with you. We're going to get some tools, some techniques for you to be able to complete those activities of daily living with less discomfort. We're going to do some manual edema mobilization is what it's called. So we'll do some of that massage that you have had experience with before, and maybe some scar mobilization as well for that scar tissue that's left over from that lymph node dissection. Does that sound like an okay plan to you?
That sounds great.